So I've been traveling around the state, typically with Dr. Celeste Phillips, our Surgeon General, but sometimes with others from the Department of Health. And we've been meeting with our county health departments. We've been meeting with our airports, our ports, with our mosquito control, whoever's responsible for mosquito control, and just make sure there's cooperation. That if there's anything that the state can do to be helpful, we're doing that. We have the travel-related mosquito, or Zika, in 29 counties in the state. We have 15 cases that we believe are locally transmitted, all in Miami-Dade and Broward counties. We have one area that's about 1 square mile north of downtown Miami that we think they're likely is still local transmission, although we're doing a lot of testing. We have tested over 2,400 people in the state so far for Zika. We've tested 340 people just in this little small geographic area, and we did not have any additional cases today. We're still at 15 cases, so we're working very hard to get people to get rid of standing water, wear bug repellent, wear protective clothing, longer sleeves and things like that. And then we're working with our mosquito control districts and mosquito boards all over the state to do a good job. We, on Monday, asked the CDC to send down an emergency response team, areas helpful with regard to mosquito control and things like that. We are working hard. Our Surgeon General is down in Miami, working hard with everybody. It's declared a state of emergency back in February for each county that has a case of Zika. We have 29 counties to date. I've gone to Washington and asked them to fund. It's been frustrating. The federal government has not been a good partner. 2 weeks ago, the president did call and offered $5.6 million from the CDC. At the state level, I had the opportunity to allocate emergency dollars. I've allocated $26.2 million around the state, and we'll do more if we need to. We have offered to anyone pregnant in the impacted area a free Zika test at our county health department down in Miami-Dade. We're rolling that out across the state, so anybody that's pregnant wants to get a test to see if they have Zika at any of our county health departments, they'll be able to do that. We're going to be rolling that out quickly around the state, making sure we have enough tests. So the state's doing its job. Our county health departments are doing their job. The mosquito boards, our airports, our ports, everybody's working well together to make sure we don't see an increase of this. Tourism, as you know, is very important to our state, so it's very important that we keep everybody informed. That's why we're being very proactive at getting the information out what's happening. Ken, you want to talk about what's happening here?
Presently, the Department of Health in Bay County did their tabletop. They worked with our local community to get our mosquito control, our local government, tying in together and making sure we're all working together with our emergency operations center to make sure that we can staff up if we need that. And so the collaboration with that, along with the airport, has been very positive in working with the community and the chambers to ensure that they're in the communication with the chamber for the tourists. Presently, we have no confirmed case in Bay County, where we feel like we're on top of trying to get the information out to the public, and that is a positive thing for us. The particular vector, Aedes aegypti mosquito, hasn't been trapped in Bay County in about 14 years, so we look good on that particular vector, and it is a mosquito-borne disease. So we look good, we're getting information, and we're making sure that the public knows that tourism and that they can come to Bay County.
We've tested about 20,000 mosquitoes around the state, and to this point, we don't have one mosquito that's been tested and found to be active that has Zika.